My name is Jessica. I'm a Solutions Manager with Managed Outsource Solutions, and I'm here to talk to you about, can you claim Social Security disability benefits for Alzheimer's disease? Social Security covers early onset Alzheimer's disease as a disability and utilizes a medical chart review to determine eligibility. The patient can apply for a Compassionate Allowance that speeds up the claim processing, and the benefits are made available sooner. According to ALZ.org statistics, at present, there are approximately 5.4 million Americans living with Alzheimer's disease. These are not all old people either. 200,000 Americans under the age of 65 have the disease at present. It is a progressive terminal illness which cannot be prevented, slowed, or cured. If the disease affects a person in his or her prime working years and progresses, he or she cannot engage in gainful employment. Since the year 2010, the SSA, Social Security Administration, has added Alzheimer's disease to their Compassionate Allowance initiative, which allows faster payment of disability payments to people with Alzheimer's disease, mixed dementia, and primary progressive aphasia. Patients diagnosed with early onset Alzheimer's disease, i.e., before age 65, may be able to collect disability benefits provided their symptoms and limitations are severe enough. Alzheimer's disease and other forms of dementia are evaluated under SSA's listing for neurocognition disorders. To be eligible for disability benefits, Alzheimer's patients must demonstrate that their abilities have severely declined in one or more of the following: using language, unable to remember words or misuse of words, learning and memorizing, planning and judgment, listening to others or focusing on tasks, physical coordination, social cognition, or the capability to know proper social behavior in various circumstances. When filing a claim for SSDI due to a diagnosis of early onset Alzheimer's disease, the applicant must include as much medical documentation as possible because these records are subject to a chart review to determine the validity of the claim. Medical records, documents, doctors' statements supporting the diagnosis, and other records will be crucial to the success of the SSDI claim. Here is a look at medical information required: names, addresses, and phone numbers of claimants' healthcare providers, including primary care physician, neurologist, neuropsychologist, and or psychiatrist. Full list of medical conditions, medications, also who prescribed them and why, names and dates of medical tests, and the names of requesting physician. Names and dosage information for all medications the claimant is taking or has taken. Medical records from all healthcare providers, including primary care physician, neurologist, neuropsychologist, and psychiatrist. The health records should ideally show that there is progressive decline in function or test scores over time. The records must state that the claimant has early onset Alzheimer's disease. Clinical information including history of onset, description of functional and cognitive impairments at home and at work, neurological, cognitive, or neuropsychological examinations results, and results from neuroimaging should be included. It would be helpful to include documentation of dementia by standardized testing such as CDR, clinical dementia rating, and a score of greater than 1. Mini mental state exam, MMSE, of less than 24, or equivalent test. Activities of daily living report or a similar report completed by caregiver or relative. As a company providing medical review solutions to disability lawyers, we understand that even if a person suffering from Alzheimer's disease doesn't qualify for the Compassionate Allowance because their condition is not considered early onset, he or she may still qualify for benefits. They will have to produce medical records that sufficiently prove that their condition makes them unable to perform any full-time job. The record should include a comprehensive explanation of the symptoms and the effect they have had on the patient's daily life. It is important to understand that not all disability applications processed under the SSA's Compassionate Allowance guidelines are approved. A claim may be denied if it is not accompanied by the necessary medical evidence or if it isn't properly submitted. Social Security attorneys help claimants prepare their application, making sure that all necessary medical documentation is obtained with the support of a medical claims review company, and the application is submitted properly to the Social Security Administration. Thank you for listening. We hope you have a wonderful rest of your day.